Hi everyone, just wanted to send out a message this lovely Monday morning, and we are all doing well, thank God, and around the world. I know that people are wondering, how can they beat this virus? So because we're dealing with a pandemic, I thought, at least every few days, if I can send out a message to you all of hope, it will be wonderful. So today's message of hope is that we actually know how to improve the body's response to viruses and bacteria. And we've known for many, many years that vitamin C has benefits beyond just, drinking orange juice and eating your oranges or your lemons. So what does vitamin C do in the setting of viral illnesses? Let's talk about it. Viruses actually, they like vitamin C. So if we take oral vitamin C, we can get levels of ascorbate up in our blood to a certain point. Oral vitamin C versus IV vitamin C, which I'll talk about a little bit later. But oral vitamin C, if we can take as adults 1 to 2 grams orally every day, sometimes up to 3 grams, if we can take 1 gram maybe twice a day or every 8 hours to get that vitamin C in our bloodstream. But oral has its limitations. We sometimes can't tolerate too much oral because of GI side effects. So if we can take oral vitamin C, that will help to increase our levels of vitamin C or ascorbic acid in our blood. What do viruses like about vitamin C? They like it. They think it's kind of a sugar for them. So viruses and bacteria, they like to eat the vitamin C in our bloodstream. But what happens is the vitamin C can trick the virus, and once the vitamin C gets inside the virus, can turn into hydrogen peroxide and actually becomes destructive for viruses and bacteria. So that's a great way to increase your immunity against viruses and bacteria. And now we're facing a pandemic. So why not help your immunity by taking oral vitamin C? A great measure. It's quite hard actually now to find vitamin C in your grocery stores or even online. So there are ways to find it, and if you can't find it in your grocery stores, try to go online and find it. There's one great website that I can let you know of called AmazingLines.com. If you go on there and look for vitamin C, it'll come up. And Douglas Lab makes an amazing vitamin C that I tell my patients about. So that's one great way to get oral vitamin C into your body, especially at this time, daily, to prevent any ill effects of any virus or any bacteria that may come upon you. The other thing that I want to teach patients about is intravenous vitamin C. Now that's been controversial over the years, and I'm not quite sure why, because many scholars have known, and even the Nobel Prize was given to a great scholar who found that IV vitamin C had many beneficial aspects to it. But intravenous vitamin C, what's been done about that? Throughout many centers, IV vitamin C has been studied and shown to have actual benefit in the septic patient. So what are we dealing with now with the COVID-19? We're dealing with sepsis as the highest risk for death. So we're seeing death rates very high around the world with regard to the COVID-19. How can we attack that, stop that? Well, we have to understand, why are people dying? And they're dying from something called ARDS. It's respiratory distress syndrome. It's when the lungs become full of fluid. Well, why is that? Because when the virus attacks the body, it kind of goes to those lungs. The lungs are so important for air exchange. That's where we exchange the oxygen that when we breathe in, oxygen has to get to the rest of the body, right? So if the body cannot absorb that oxygen from the alveoli or the air sacs in the lung, then we can't get the oxygen to the rest of the body. And that's why people feel like they can't breathe, because the oxygen is not getting to where it needs to go. what happens with viral illness and sepsis in those air sacs is that our white blood cells, some of them are called neutrophils. We have many different white blood cells. The neutrophils kind of get into attack mode, and they kind of disgorge all of their DNA. So as the neutrophils are entering from the bloodstream into the lung sacs, they're kind of throwing up their DNA, and that DNA becomes like a net. It's called NET, net. And that conglomeration of DNA becomes kind of sticky, and it causes a lot of problem for oxygenation of the body. So oxygen cannot go where it needs to go. So this causes ARDS. Patients end up on ventilators. We have such a problem now with ventilator. We need ventilators worldwide, right? Maybe we could stop the need for ventilators if we can let intravenous vitamin C, which can traverse these the endothelium or the lining of the capillary, which lines these alveolar sacs. If we can let vitamin C come in there and get into the alveoli, we can stop that net production and stop those neutrophils from causing damage, and stop all these things called cytokines and chemokines and everything that causes inflammation, kind of stop or decrease that process so that patients can heal if they're septic. And so there have been trials done to show that patients actually heal, decreasing the amount of neutrophils, or how we measure the DNA that's spilled out of those neutrophils. Studies have shown decrease in that, and even recent studies that were published in peer-reviewed journals. So we know that there's great benefit of intravenous vitamin C. It can be found worldwide in whatever country you are. Ask for intravenous vitamin C as a way to benefit possibly what is happening to the human body when it's attacked by COVID-19. Many doctors are working round the clock to find vaccines and treatments, and we love that and we applaud them. But in the meantime, let's think about using vitamin C as part of the armamentarium to help stop the widespread illness. I love you all, and I wish for you all the best. How do we get the vitamin C? Remember, go to AmazingLines.com and look up vitamin C-1000. That's 1 gram of vitamin C from Douglas Lab. Another way to help yourself is intravenous vitamin C and Dolce Vita Cardio. We do provide IV vitamin C at the doses that have been shown to be beneficial. Call 281-866-7701 for more information.